Okay, hello everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us and happy Pride Month. Today's webinar is on ensuring equitable access to coverage for LGBTQI plus people. My name is Aizat Odiale, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities. I'll be moderating today's webinar. And today's session is presented in collaboration with the Whitman-Walker Institute and Out2Enroll. Beyond the Basics is a project of CBPP. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and we are not able to offer continuing education credit for our webinars at this time. Webinar logistics. Automated captions have been enabled for this webinar. To view them, you can click the CC icon at the bottom of your screen. If you don't see the icon, you may need to click the More option with 3 dots first to see the closed caption option. All participants are muted and in listen-only mode. If you would like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A during the presentation. We may not be able to answer every question that is asked today, but we will have a record of all of your questions and we will use them as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. And just a quick reminder that you won't be able to click anything that's on the screen to go to any links shared in the deck, but we will put these slides in the chat for everyone to refer to. So for today's agenda, we will start by introducing our speakers, and then we will move on to LGBTQI plus inclusion, Section 1557 of the ACA, LGBTQ inclusive data collection on healthcare.gov and state-specific enrollment applications. We will have Q&A and then resources. So now I will turn it over to our speakers.
Thank you so much, Ayasat. This is Kellan Baker. I use he, him pronouns. I'm the executive director of Whitman-Walker Institute. The Institute is a national organization that leverages cutting-edge research, policy, and education to advance health equity nationwide, with a particular focus on LGBTQI+ communities. The Institute is affiliated with Whitman-Walker Health, which is a federally qualified health center in Washington, D.C., with more than 50 years of experience serving diverse communities across the DC area and beyond. Whitman-Walker Health is also one of the organizations that has worked closely with the DC Health Benefit Exchange to do enrollment, to ensure that people in the Washington, DC area have access to the health insurance coverage that they need. And Whitman-Walker Institute is also a partner of the DC Health Benefit Exchange, working on implementing standard plan designs to advance health equity. So all across the Whitman-Walker family, we have a great deal of interest and expertise in health insurance coverage and are very grateful for the role that you all play in making sure that people across the country, including LGBTQI people, can access the health insurance coverage and the care that they need. I'm also the founder and current director of Out2Enroll, which has now become a project of Whitman-Walker Institute. The Out2Enroll initiative was launched as a public-private partnership with the Obama administration in 2013, at the very beginning of the open enrollment periods for the health insurance marketplaces, both the federally facilitated marketplace and the state-based marketplaces. We worked very closely with the Obama administration and partners across the country, including the Beyond the Basics team and others who are in the navigation and enrollment space, to ensure, again, that everyone can access the health insurance coverage and the care that they need, with a particular focus throughout to enroll on low and middle income LGBTQ+ people, to ensure that they have access to the subsidies and appropriate plan designs through the health insurance marketplaces, and to connect them when appropriate and possible with Medicaid coverage. Without any further ado, though, I want to turn today's presentation over to my colleague, Kellan Medina, who is going to talk with us about some of the content areas that come up most frequently for LGBTQI+ community members. This is based on the more than 15,000 trainings or 15,000 navigators that Out2Enroll has trained over the last decade. So we hope that you will see a lot of questions that may be coming up for you in your work, but also welcome additional conversation and questions related to some of the specifics of what it looks like to work to connect LGBTQI+ people, as well as members of other diverse communities, with appropriate health insurance coverage in 2024 and beyond. Well, Kellan, over to you.
Thanks, Kellan. Hi, everyone. As Kellan said, my name is Kellan Medina. I use they, them pronouns, and I'm Director of Policy for the Institute. Very excited to be here with you all today. And we're going to start off today with a little bit of a primer about LGBTQI inclusion. So the first thing that we really want to remind folks of is that LGBTQI folks can be found in every community across the country. There are over 13 million people who identify as lesbian, gay, bisexual, or transgender in the United States, which is a significant and growing proportion of the US population. The community has health disparities and a history of underinsurance, and those outcomes are driven by interpersonal and systemic discrimination, as well as other social determinants of health. No matter what community you live in or what community you are doing outreach to, there are LGBTQI people who call that place home. LGBTQ people also have an incredible amount of diversity within any label or identity, so it's important not to make assumptions. The Affordable Care Act protects LGBTQI people from discrimination in health insurance coverage and healthcare, and we'll hear more about that today. Lastly, it's our job to help people connect with coverage that will work best for them. To start, we'll briefly go over some terms that we'll be using today. So even though we talk about LGBTQI people as though it is just one community, there are actually a number of aspects of identity that are wrapped up in that sort of umbrella term. The first is sexual orientation. So aside from straight or heterosexual, other terms used to describe sexual orientation are gay or lesbian, bisexual, and more recently, many younger LGBT people have reclaimed the term queer. Because the word queer has a history of being used as a slur against LGBTQI individuals, we don't recommend that you use it when talking to or about LGBTQI community members, unless you are talking to somebody who has specifically asked you to refer to them by that identity. The other aspect wrapped up in this LGBTQI umbrella is gender identity. Gender identity describes each person's deeply felt internal knowledge of their own gender and affects how you understand yourself, how you go through the world, and how other people interact with you. Every person has a gender identity, and most people identify as cisgender, meaning they feel comfortable in the body they were born in and with the sex they were assigned at birth. A transgender person, or trans person for short, is a person whose gender identity is different from the sex they were assigned at birth. A trans woman is a trans woman who is assigned male at birth. Transgender women are women, and the right gender pronouns to use for her are she, her, and hers, and titles such as ma'am. A trans man is a man who is assigned female at birth, so his original birth certificate says F, but he lives and identifies as a man. Transgender men are men, and the right gender pronouns to use for him are he, him, his, and titles such as sir. And we'll be learning more today about other pronouns and how to approach those sort of conversations with folks trying to access coverage to care. There are also an increasingly large number of people, especially young people, who identify outside of the boxes of male and female entirely. Some of the terms you may hear used to describe those people are genderqueer, gender nonconforming, and non-binary. All of these terms are used to describe people who do not identify as exclusively male or exclusively female. The right terms to use for those folks who may identify as non-binary might be they, them, theirs. It's always best to ask someone their gender pronouns, and you can help people feel comfortable by providing yours when introducing yourself, as I did when I started the presentation. Next, intersex is an umbrella term that's used to describe people born with sex traits that do not fit binary medical definitions of male or female sexual or reproductive anatomy. There are currently limited data and information available on the population health and overall well-being of people with intersex traits. However, recent research has found that health disparities among intersex populations are driven largely by stigmatization, prejudice, and discrimination, similar to what other parts of the LGBTQ community experience. Just a brief note on terminology for today's presentation. When talking about discrimination, and especially values related to advancing equity, we'll use the term LGBTQI, that is inclusive of intersex folks. When we're talking later on about data collection, we'll focus more specifically on sexual orientation and gender identity. So you may see the acronym shift to LGBTQ, or referring specifically to sexual orientation and gender identity, or SOGI. Here we've provided some examples of terms to use and avoid. Some of the terms that we recommend that you avoid when talking to or about LGBTQI folks include old terms such as homosexual and transsexual and transgendered. Those terms are considered outdated, and many folks find them to be offensive. It is also important to not use the dehumanizing term a transgender to refer to a transgender individual, and transgender is not a noun, which is important to keep in mind. You are also likely familiar with terms such as sex change or sex change surgery, but this is actually a pretty inaccurate term because there's no such thing as a, quote, sex change. There's no one magical procedure that transgender people undergo in order to transition from one gender to another. The term sex change is increasingly being replaced by the term gender transition, which describes the whole process of social, legal, and medical steps that trans people may undergo in order to transition from one gender to another. Instead of the term sex change surgery, we use the term gender affirmation surgeries. And when discussing medical transition, please use the term gender affirming care. Many transgender people may choose to undergo some kind of transition. Gender transition describes the social, legal, and medical steps that many trans people undergo in order to be able to present themselves in society in a way that feels more authentic with their internally held gender identity. You do not want to assume that a person who tells you they are transgender is planning to undergo all aspects of transitioning. Not all trans people will complete all of these aspects of transitioning. It is a very personal decision, and there's a wide diversity among people who identify as transgender. It's also important to know that medical services for a gender transition are medically necessary, and to know that trans people may use a name and/or gender pronoun that is different from what is on their legal ID. This is because in the United States, there are a lot of different authorities that oversee documents such as driver's licenses, birth certificates, passports, and other forms of identification. It can be very difficult and in some cases impossible for a transgender person to legally change their name and gender on all of these forms of identification. So when you're talking to a trans person in enrollment, you may find out that they go by a different name or use a different gender than what is on their identification documents. We'll talk later about how to handle that situation in an enrollment context. So to put a finer point on inclusion, I just wanted to use the example of what name to use on an application. In conversation, you should use the name and pronoun that the person prefers. When it comes to filling out the application, we recommend to use the name the person uses to file federal taxes in order to make sure that they can get through identity verification. Gender data from the application are not checked against the Federal Data Hub, so there's no such thing as a mismatch between the application and the Federal Data Hub. However, we still recommend using the gender that's on the person's Social Security record, which is typically the gender that they use to file federal taxes. You can let trans consumers know that their name and gender on the account can be changed after enrollment by contacting healthcare.gov or your state's marketplace. It's also important to be aware of language and not to make assumptions about people's gender on the basis of their voice or what's on their identity documents. If you're in doubt about what somebody's gender is or what the best way to refer to them is, it's best to politely ask rather than guessing. Some of the questions you could use include, how would you like for me to refer to you? What pronouns do you use? How would you like to be addressed? Once you find out what the correct name and gender pronoun is for somebody to use, write it down so that you don't forget it, and so that any of your coworkers who will work with this person in the future will have that information ready at hand. You also want to make sure to consistently use the correct name and pronoun moving forward, in conversations with the person and in conversations about the person, even if they're not there. If you do make a mistake, it's totally fine. It happens to all of us. The best thing to do is to politely apologize and move on. Did you accidentally say sir to somebody who said, excuse me, I prefer to be called ma'am? That's easy to fix. Oh, I'm sorry, ma'am. How can I help you? It's very important to not make assumptions about who you think is LGBTQI or not. Remember that LGBTQI people are diverse in terms of factors such as race, ethnicity, and language, as well as factors such as gender and gender identity, sexual orientation, relationship status, for example, whether somebody is legally married or not, and family configuration, for example, whether somebody has children or not. When talking to people about their families, use gender-neutral language such as partner, spouse, and parent rather than husband and wife, or mother and father. There are a lot of same-sex couples in the United States, and a lot of them have children. And because one of the areas of legal protections for LGBTQI people that has changed the fastest over the last few years is actually marriage equality for same-sex couples, you may be working with the same-sex couple that doesn't describe themselves as legally married. They might use terms such as partner, when actually they are legally married and will be treated by the marketplace or by Medicaid as a legally married couple. Wherever possible, it's best to allow people to point or write down answers themselves on forms so that you're not guessing when you're trying to fill out information about aspects of their identity, such as gender or what somebody's relationship looks like. That concludes our sort of primer for today. We are going to move on to talk in a little bit more detail about Section 1557 of the Affordable Care Act. First, as I noted earlier, LGBTQI people continue to face widespread discrimination in health insurance and healthcare settings, which detrimentally impacts the mental and physical health of LGBTQI people. Here we have a few examples from some surveys that have been conducted in recent years. As you can see from the first statistic, 23% of LGBTQI respondents, this includes 37 of transgender respondents, reported postponing or avoiding needed medical care in the past year due to disrespect or discrimination from providers. From that same survey, data shows that 28% of transgender adults reported that a health insurance company denied them coverage for gender-affirming hormone therapy. And also, recent data from the US Trans Survey found that nearly half of transgender respondents who saw a provider in the last year had at least one negative healthcare experience because of their gender identity. This kind of discrimination results in avoidance behaviors, delays, or denials of care that exacerbate health disparities. And it's important to note that due to the intersecting impacts of racism, ableism, and other forms of oppression, these inequities are often more pronounced for LGBTQI people of color, LGBTQI people with disabilities, and others living at the intersection of historically marginalized identities. These data really underscore the importance of non-discrimination in healthcare and health insurance. That brings us to Section 1557 of the Affordable Care Act. So as the primary non-discrimination provision of the Affordable Care Act, Section 1557 prohibits health programs or facilities that receive federal funds from discriminating based on race, color, national origin, age, disability, or sex, meaning that an individual cannot be excluded from participation in, be denied the benefits of, or be subjected to discrimination on these bases by any health program or activity that receives federal financial assistance. Since the enactment of the ACA in 2010, Section 1557 has undergone regulatory rulemaking numerous times. First by the Obama administration in 2016, when the administration clarified LGBTQI non-discrimination protections, and then again in 2020, when the Trump administration issued a rule that eliminated non-discrimination protections based on sexual orientation, gender identity, and sex stereotyping. When we're talking about the newly released rule in 2024, it's important to note who this applies to. And this rule applies to health programs or activities that receive HHS funding, health programs or activities administered by HHS, such as the Medicare Part D program. It also applies to the health insurance marketplace and all plans offered by issuers that participate in those marketplaces that receive federal financial assistance. And it does apply to federally funded navigators, as well as to agents, brokers, and web brokers who sell QHPs. Those covered by the rule may include hospitals, health clinics, health insurance issuers, state Medicaid agencies, community health centers, physicians' practices, and home health care agencies. I should also mention that there are requirements, such as those related to posting non-discrimination notice and notice of availability, of language assistance and auxiliary aids and services. And you can find more information about this on the HHS FAQ page that we link to later on. As I mentioned, 1557 has undergone rulemaking a number of times, most recently this year. So the new 1557 rule that was finalized just back in April restores and expands healthcare and health insurance non-discrimination protections for LGBTQI populations that were previously eliminated by the Trump administration. Specifically, the final rule provides that sex discrimination includes, but is not limited to, discrimination on the basis of sexual orientation, gender identity, sex characteristics, which includes intersex traits, pregnancy or related conditions, and sex stereotypes. In June of 2020, the U.S. Supreme Court held that the prohibition of sex discrimination in Title VII of the Civil Rights Act of 1964 includes discrimination on the basis of sexual orientation and gender identity, and the final rule is consistent with this ruling. As I said, this prohibition applies to all health insurance issuers that are recipients of federal financial assistance, which includes Medicare Part C and D payments, as well as state Medicaid agencies. Looking specifically at the protections for transgender people in Section 1557, it's important to know that the final rule prohibits providers from denying or limiting health services based on a person's sex assigned at birth, gender identity, or gender otherwise recorded. So, for example, a hospital that routinely provides gynecological or obstetric care could not deny a transgender man a pelvic exam or pregnancy-related care if that entity typically provides such care to cisgender or non-transgender individuals. It also requires that transgender people be treated in accordance with their gender identity in hospital room assignments. That means that a trans woman would be able to be housed in a hospital ward with other women, or a trans man would be able to be housed in a hospital ward with other men. The rule also prohibits Medicare, Medicaid, the health insurance marketplaces, and private insurance carriers from discriminating against LGBTQI people seeking health insurance coverage. Specifically, plans cannot deny coverage of preventive screenings based on sex. This means that transgender men who still have a cervix need a cervical pap test. Transgender women with prostates still need a prostate exam. And everybody who has breast tissue needs a mammogram. Health insurance plans are required to cover those services on the same terms and conditions as they do for non-transgender people. They cannot limit access to sex-specific services on the basis of the person's sex assigned at birth, their gender identity, or their gender marker on their insurance card or in their medical record. Section 1557 also bans categorical transgender insurance exclusions, which means language in a health insurance plan that deny transgender people access to medically necessary health care. You can see some examples of transgender exclusions here, including exclusions for procedures, services, and supplies related to sex transformation, transsexual surgery, regardless of medical necessity, and all services related to gender dysphoria or gender identity disorder. Those are terms that psychologists use to describe transgender people's need to medically transition. It's important to remember that the services blocked by such exclusions are medically necessary for transgender people, according to expert associations such as the World Professional Association for Transgender Health, the American Medical Association, the American Psychological Association, and the American Psychiatric Association. And that asterisk there is meant to indicate that while these are sort of real life examples, they also clearly include some terminology that we do not recommend you use. While the ACA bans these exclusions in health insurance plans nationwide, including any plans sold through a health insurance marketplace and state Medicaid program, many plans still have exclusions that deny transgender people access to preventative care, mental health counseling, hormone therapy, and gender affirmation surgeries. Consumers need assistance to identify them and to figure out what their options are in case they end up buying a plan that has an exclusion, or in case they end up being denied coverage for the services that they need. It's important to take a look at the plans that are being offered in order to determine if they have transgender exclusions. These exclusions cannot be seen in the summary of benefits and coverage. They can only be found in the evidence of coverage or the certificate of coverage, the detailed plan documents that are typically available when somebody enrolls in a plan. This should be linked in the summary of benefits and coverage. If you are not able to find it, search in the exclusion section and use Control Find to search for mentions of hormones, treatment for gender dysphoria, etc. Another important detail of plan design is the plan formularies, making sure that the medications that are used to treat conditions such as HIV are not in high or unaffordable cost-sharing tiers, and that hormone medications for transgender people are covered. One question we have regularly received is, how does this rule impact the many state-level bans on gender-affirming care that have passed in states across the country? As of now, 24 states have adopted bans on best practice medication and surgical care for trans folks, and increasingly these policies apply not just to youth, but also to adults. The rule states clearly that Section 1557 preempts state law, making the state-level bans illegal. However, enforcement of the rule against states is complicated by a variety of factors, such as whether the state-level entity that enforces a state's ban is an entity that actually receives federal funding and thus can be investigated by the Department of Health and Human Services Office for Civil Rights, or OCR. Multiple courts have found that the ACA prohibits anti-LGBTQI discrimination, and having a clearly defined rule from HHS adds significant weight. The rule provides an important tool for litigators who are engaged in a larger ongoing strategy to leverage federal law against the state bans. And this strategy is underway, as we can see in the recent Fourth Circuit ruling ordering North Carolina and West Virginia to end their discriminatory exclusions for coverage of affirming medical care for transgender people in both states. One thing that I think is important to emphasize, and then we'll continue to provide resources for, is that folks who feel like they are encountering discrimination should file a complaint with OCR. Another question that we have gotten regards requiring coverage or treatment. The rule does not require a specific standard of care or course of treatment for any individual, minor or adult. Providers do not have an affirmative obligation to offer any health care, including gender-affirming care, that they do not think is clinically appropriate. HHS has a general practice of deferring to a clinician's judgment about whether a particular service is medically appropriate for an individual. The final rule does not require those covered to cover a particular health service for the treatment of gender dysphoria for any individual, minor or adult. Rather, it prohibits health insurance issuers, state Medicaid agencies, and other covered entities from excluding categories of services in a discriminatory way. Coverage has to be provided in a neutral and non-discriminatory manner. Lastly, we'll provide some information related to dealing with denials. So first, individuals who encounter denials of coverage can appeal the denial with the insurance carrier or the Medicaid program. Individuals who experience discrimination in health insurance coverage or in healthcare can also file complaints with the Office for Civil Rights at HHS, as I mentioned. OCR is actively investigating complaints of discrimination from transgender people and LGBTQI people generally in states across the country. People can also file complaints with the state insurance commissioner and with the state attorney general. There's a number here that we've provided, as well as the healthcare.gov website, which provide an unofficial way to share information about discrimination or other problems that people are encountering. And finally, individuals can sue in federal court under 1557 if they have experienced discrimination on the basis of sex, including identifying as LGBTQI. We will pause there for a minute and open things up to see if folks have questions about 1557 of the ACA before we turn to some of the data collection topics for today.
Yes, thank you so much, Caroline, for both of those sections. And we do have some really good questions. So to start, I know you mentioned that Section 1557 is kind of exempt from state bans, but there is some nuance to that. So a question is, does the 1557 protections apply in all states?
Yes, so the 1557 rule does preempt, as a federal rule does preempt those bans.
And a follow-up question is, when do the newest changes to 1557 take effect?
Sure. There's multiple parts of the rule that are actually operating on somewhat different timelines. If at the end we provide resources to the HHS FAQ page, for example, and that actually really clearly lays out the different sort of enforcement timelines that apply to the rule.
Awesome, thank you. And another question is, in a healthcare practice, where the medical team consists of mostly cisgender people who are unaware of LGBTQI plus people, or maybe they're unsupportive. Do you have any guidance on how to provide any training or just how to go about that situation?
Sure. I mean, cultural competency is definitely really important to make sure that folks feel like they're able to access the care that they need equitably, and also in an environment that is affirming to them. And Whitman-Walker actually does offer cultural competency training for medical professionals. So I will make a brief plug there for our own educational resources. There are some others online, and I'm happy to drop some links to that as well. But there are at Whitman-Walker and in many places across the country, cisgender or non-LGBTQI healthcare professionals that are able to provide this care in affirming ways, regardless of how they themselves identify. And it's really important to make sure that all patients feel that they are welcome in speaking with somebody that respects their identity and affirms it in healthcare settings.
Awesome. And just another question we have here, and you kind of briefly touched on this, but just to restate it, where should navigators refer people for help filling out discrimination forms? Will community legal aid normally handle this?
That's a good question. I'm not sure, Kellan, if you have more information about that. I believe that there are resources on the HHS website. And I know that our legal team has also helped folks in the past, but Kellan, is there anything that jumps out to you in terms of resources to help folks file complaints?
The first stop is the OCR, the HHS Office for Civil Rights website, which does provide information and assistance with filing a complaint. There are a number of, is the question noted, legal aid organizations. For example, we work closely with a number of the state legal aid organizations. We also work with entities like the National Health Law Program, and the Transgender Legal Defense and Education Fund, all of which have a lot of expertise and experience, or many of which have expertise and experience in working with transgender people in particular. So we'll be happy to share some follow-up resources about where folks can go for assistance with looking for help in filing a complaint. And one other quick thing that I wanted to say, in addition to Caroline's excellent answer to the previous question, with regard to areas where folks are unfamiliar with LGBTQ plus issues, or where folks maybe don't feel like that's relevant in a healthcare setting, this is really important, not just from a non-discrimination perspective. It is federal law that folks have access to the healthcare and coverage they need without encountering discriminatory barriers on the basis of sexual orientation or gender identity. It's also a quality of care issue. So making sure that everyone can access the right care is something that all of the quality assurance organizations in both health insurance coverage and healthcare really care about. And they include LGBTQI plus populations. So this is about, as Caroline noted, making sure that everyone can access the care they need when they need it. And it's about making sure that everyone is providing the type of care that is the highest quality to everyone. And that is something, again, that a number of regulatory bodies are looking at. It's also something that patients believe is important. So really appreciate the question, and we'll be happy to provide any additional information that we can about some of those conversations, and how to make sure that we're conveying that information to everyone who needs it. And yes, I see in the chat here, the Joint Commission addresses this, which is 100% correct.
Thank you, Kellan. And we have just a couple more questions before we move on to the remaining sections. So we have a question saying, where can people find the summary of benefits and coverage? Is this required to be provided before a person enrolls in a plan?
Technically, they are required to be made available. That is the law, part of the ACA. It is, however, something that we know. We do research every year, Out2Enroll, does research on the availability of inclusive coverage for transgender people. And every year we find that about 10 to 15% of SBCs or other plan materials that are supposed to be available to people before they enroll are not publicly available. So that is a real challenge for a lot of consumers. It's one of the reasons why navigators and other consumer assisters are so important. Really being able to be in touch with the plan and asking for the information that folks need to make an informed decision is a really important component of assisting anybody, but transgender people in particular who have so many reasons to fear that the coverage that they may be looking at will not actually meet their needs.
Awesome, thank you. And so we just have one last question before we move on. Do these protections extend beyond the ACA?
There are, and Caroline, I welcome your thoughts on this as well. So the Affordable Care Act, Section 1557, extends to any health program or activity that receives federal funding. So that is, given the way our healthcare system is set up in the United States, that includes pretty much all health insurance carriers, hospitals and other healthcare institutions, and providers. There are some complicated questions, such as the health insurance coverage that's provided by an employer. There are some instances in which an issue with that coverage might be handled under a different law, under Title VII of the Civil Rights Act, which looks at, under the Civil Rights Act, which looks at the ways that employment protections are guaranteed under federal law. But for any health program or activity that comes into contact with federal dollars, and again, that's Medicare, Medicaid, the health insurance marketplace subsidies, and a raft of other types of federal assistance, any entity that receives those federal funds in any form is a covered entity under Section 1557.
Thank you. And so I think with that, we can move on to the next sections, and there will be time again at the end of the presentation to ask questions.
Great. Thanks, folks. So for the first time ever, CMS has actually added 3 new optional demographic questions on the marketplace application regarding sex assigned at birth, sexual orientation, and gender identity. These questions are being asked on all healthcare.gov applications, online and paper, for all individuals or members of a household over the age of 12. They will appear alongside other demographic questions, such as those about race and ethnicity. And each question is optional and offers a free text box for consumers to describe themselves in their own words if they do not wish to select one of the other response options that are available to them. State-based marketplaces and state Medicaid and CHIP agencies will also have the opportunity to include SOGI questions on their applications. States have the option either not to add these questions or to add the same version of the questions that have been added to the healthcare.gov applications, or to add their own modified version of those SOGI questions. The new questions will be used to analyze LGBTQ population disparities and access to coverage. Collecting this information will help to improve the consumer experience by enabling consumers to share information about themselves in a way that better reflects and affirms their identities. At this time, CMS states that any data received from the new optional questions won't be shared with downstream systems or agencies, including health insurance issuers or state Medicaid and CHIP agencies. This is particularly important to note in light of the anti-transgender attacks that we have been seeing in states across the country that I mentioned earlier. The information will be used to examine patterns of access, quality, costs, and health outcomes, and misuse of those data to perpetuate discrimination constitutes a violation of Section 1557. And here you can see the optional questions that have been added. Again, there are sort of 3 categories here. The first is sex assigned at birth. What was the individual's sex assigned at birth. You can find this information on original birth certificate or a similar document with the option to select one response. Female, male, a sex that's not listed, free text, not sure, prefer not to answer. Male and female, you'll see here, there's the sex that's not listed would be an anomaly. It's perhaps an attempt to be intersex inclusive, but intersex is not an option on birth certificates in most states quite at the moment. So most of the time, again, you will be dealing with folks responding male or female. There's also on all questions, responses of not sure or prefer not to answer, which are best practice for including when asking about sexual orientation and gender identity. Next, you'll see a gender identity question. What is the individual's gender identity? Again, optional with a single select. Female, male, transgender male, a gender identity that is not listed with a free text. And this free text option for both gender identity and sexual orientation is really an important piece of inclusion because folks have many sexual orientations or gender identities that are not listed here. And so this really gives folks an opportunity to provide the identity in writing that they feel most reflects themselves, which is a really great opportunity and a good point for inclusion. You'll also see that this is a sex assigned at birth and gender identity questions are together. So this sort of approach to collecting data relies on what is called a two-step approach, which asks about both current gender identity and sex assigned at birth. And this approach enables people to be recognized as transgender if they either select one of the transgender options as their current gender identity, or if they select a gender that is different from the sex they were assigned at birth, thereby including those who may not use the term transgender to describe themselves. Lastly, you'll see a question about sexual orientation. Again, this is optional and a single select, and the options are lesbian or gay, straight, bisexual, or a sexual orientation that is not listed, again, with that free text option. I won't linger too long here, but I did want to give folks a sense of what this actually looks like. In this highlighted bottom section below, you can see the sex assigned at birth question with a note that it may be found on your birth certificate, as well as the current gender and sexual orientation selections. We definitely appreciate that CMS is taking action to incorporate sexual orientation and gender identity measures into the marketplace application. But it's really important to note that these questions will not replace the application's pre-existing binary sex question. The existing binary sex question is used to assess eligibility of benefits. For example, enrollees must select female in order to be considered for Medicaid eligibility related to pregnancy. It is also used for identity verification, and it is recommended that enrollees select the option on the binary sex question that they believe is on their Social Security record. The application provides help text, as you can see here, for enrollees to understand the purpose of this question. We wanted to highlight some best practices for asking these questions, which may be new to folks. It's important to explain to consumers that the data collection effort is essential and is an essential part of research, policy, and advocacy work so stakeholders can have a more accurate idea of how many LGBT people are accessing marketplace plans, where there are gaps in coverage, and how LGBTQ health disparities relate to access to coverage. That said, it's important to remind respondents that responses to these questions will not impact eligibility or plan pricing. Emphasize that answers will not be shared with issuers, Medicaid, and CHIP agencies or other third parties. Ensure consumers understand that the questions are optional and that they can skip any question or respond prefer not to answer. It's also important to ensure consumers understand that they can use the free text response options to enter their own preferred terms. And at any time, consumers can update their responses to the new SOGI questions, including changing or removing their previous responses. That said, if consumers feel uncomfortable being truthful about their identities, that's okay. Again, the questions are optional. They can skip or reply or prefer not to answer. They can also update, change, or remove their previous responses at any time. And it's just really important that this information is shared with consumers so that they can make an informed decision about how and whether they want to answer these questions. Please note for yourselves that answers to these questions should always be self-reported. Assisters should not guess at the answer or provide any answer based on freely shared information from your conversation with the consumer. A consumer may tell you they are married to a same-gendered partner, but you don't know from this information if they identify as gay or lesbian or bisexual or pansexual or another term. You should always explain the purpose of the questions, let consumers know they are optional, and ask them to choose an answer for themselves. So the questions themselves are optional for respondents to answer, but navigators and assisters must ask them so that consumers can decide for themselves whether or not to answer them. And that's a really important point. To sum up these new questions that have been added, these data collection efforts will really help LGBTQ communities and help researchers better understand access to and barriers to care. There are free text fill boxes if the given response options do not fit, so folks can enter the identity that they feel is best. These answers are private. They will not affect eligibility or pricing and will not be shared with issuers. It's okay to skip the question or respond prefer not to answer. Please give clients the opportunity to select an answer for themselves. Do not do it for them, even if they have already told you about their partner or an aspect of their identity. And consumers can update their answers, change or remove them at any time by contacting healthcare.gov or your state's marketplace. And we will pause there for some more questions about the SOGI data components before we share some additional resources.
Yes, again, thank you, Caroline, for the great presentation. And folks are very engaged and have a good amount of questions. So to get started, we have a question from someone asking, can parents answer these questions on behalf of a child? This answer may change from one year to the next as they become an adult.
Yeah, so the question can be asked of those who are 12 and up, and we do understand that the answers to these questions may change over time.
And so another question is, do the new SOGI questions apply in all states or only healthcare.gov states?
So CMS has added, again, these 3 optional questions to the healthcare.gov application. State-based marketplaces do have options to include it. They can either not include it, or they can include the questions as they appear on healthcare.gov, or they can follow a process to add questions that are modified versions of what will appear on healthcare.gov.
Got it. So we have another question. Since the disability discrimination falls under both 1557 and the ADA, what is the best avenue for filing these claims?
Discrimination complaints based on disability under the ACA would follow a very similar process to the one that we outlined earlier, with resources available on the HHS website. And that really is a place where you can file complaints related to sort of any of the protected characteristics that we mentioned earlier.
Yeah, in healthcare, filing a complaint of disability discrimination under Section 1557 is the best avenue. The ADA applies very broadly, but HHS also enforces Section 504 of the Rehabilitation Act, which is the primary non-discrimination provision of the ACA and is incorporated into 1557. So filing a complaint through the U.S. Department of Health and Human Services Office for Civil Rights under Section 1557 is the major way to file a claim of disability discrimination in health insurance coverage or healthcare.
Thank you. And we have like a scenario kind of based question. When working with a enrollee from previous years, is it appropriate to say, when filling out the gender question, in quotes, is it accurate to say this hasn't changed since last year? And that is a question coming from the assister to the enrollee asking, is it accurate to say this hasn't changed since last year in regard to their gender?
Kellan, I don't know if you have,
That certainly seems appropriate to me. It's all about kind of the vibe and how you are establishing a rapport relationship with the person that you're working with. You can always just put the form in front of them or ask them each question on the form and say, we ask all questions of every person to make sure that we don't miss anything. There's sort of nothing special, nothing specific about any of these questions, but please answer them as best you can. If you are coming to some questions that you think are unlikely to have changed from a previous year, and it is a good relation, you feeling like you're building a good rapport with the consumer, saying, I might ask, is there anything on this form that has changed from last year? If you're working with somebody who already has a pre-populated form.
Thank you. That's very helpful, I know, to a lot of folks right now listening. So another question we have is, for what purposes is HHS authorized to use the responses to the SOGI questions?
Caroline, I'm going to defer these.
Yeah, I mean, right now, and I can go back to sort of the opening where we talked about this. CMS states that any data received from the new optional questions won't be shared with downstream systems or agencies, including health insurance issuers or state Medicaid and the CHIP agencies. The data are really going to be used at the aggregate level to get a sense of patterns of access, quality and outcomes. I'm not sure if there's a particular scenario you have in mind about use beyond that, but the idea being that they will be reporting out at a high aggregate level about their findings. So nothing traced back to like an individual level, for example.
Right. And just, I believe, one last question, at least for now. Can you explain again which responses get shared with the insurer and which information only goes to HHS?
Yeah, so the 3 new optional questions, that information is not being shared with those additional parties and will only be going to HHS. Again, this is not the case for this existing binary sex question, which is distinct from these 3 new questions.
Great, thank you. And I believe that is all the questions that we have right now. Of course, folks can ask questions in the chat or feel free to add more questions or re-ask a question if you didn't understand the first time. But I think for now, we can move on to the resources.
Great. Let me pull those up. Yeah, so throughout today's presentation, we referenced a number of different resources that we wanted to make sure that you all have available. So the first is the HHS OCR frequently asked questions on 1557, as well as more detailed information about how to file a complaint. We also have Out2Enroll guidance on the new SOGI questions and a tutorial video to help address SOGI questions with consumers. And then lastly, an Out2Enroll's transgender health insurance guides as well, which may be helpful for folks to take a look at. CMS also has its own explanation on the new SOGI questions in the Marketplace application. We've also linked here to the National Health Law Program, Section 5057 resources, which we mentioned earlier, may provide legal assistance. And then we've also included the Beyond the Basics Guide, summary of benefits and coverage.
Awesome. Well, thank you so much again, Caroline, for today's presentation. And thank you, Kellan, for answering the questions. This was very engaging. And I think I can just speak for everyone that this was very important and useful. So these are the contacts for Kellan and Caroline, and of course, general inquiries, you can send that to beyondthebasics@cbp.org. As a reminder, we will be distributing the materials from today's session via email, and everything will be posted to the Beyond the Basics website. If you have any questions or need assistance, please reach out to us. And lastly, we know that many of you here are in the midst of preparing grant applications for FFM Navigator grants. Hang in there, and we wish you so much success during the process. So with that, we will bring this webinar to a close. Thank you, everyone.